Okay, so how to write an OET introduction in less than 1 minute. How can we do it? Well, the first thing you need to do is limit yourself to 2 sentences only. I think in any OET introduction, usually you don't need more than 2 sentences. However, there are always exceptions. So I will just say that, everything I'm teaching today is just something that will usually be helpful. However, you need to respond to what comes in front of you in the exam. I know that OET do try and change things up a little bit to try and make you adapt. However, if you have this skill of being able to write an OET introduction in 1 minute or less than 1 minute, that's a good skill to have, okay? It makes you feel confident, and it also means that you go into the exam feeling like as long as it's if it's a good typical set of case notes that I'm used to, I'll be able to write my introduction very quickly. Okay, so in this class I'm joined by a few students. We have Raji, who's here. We also have Jansi, and we have Dachayani. I'll be asking them questions as we go through the video. And they'll be doing their best to answer my questions. So let's start now. So we know there are 2 sentences in your OET introduction. And I've got this table here which explains kind of the 4 things that you need. You need to tell me the name. You need to tell me where the patient has gone. You need to give me a reason for the patient going into the hospital or going into the clinic. And you also need to give the cause if it's possible. Sometimes there will be no cause, so you don't need to use that, which is why I have put this in purple. Now, let me just give you some examples because this is very theoretical. Let's have some real examples. Raji, can you give me an example of how you might start sentence 1 in an OET letter? Can you finish that for me?
Yes, sir. I'm writing regarding.
Good. Writing regarding. And let's think of a name.
Mr. Smith.
Mr. Smith, fantastic. All right. So this is the first part of our first sentence in your introduction. It's always I'm writing regarding plus name. Simple. Okay, Jansi.
Yes, sir.
Jansi, what do we usually say next in an OET letter?
Who was admitted to our
Yeah.
hospital?
Do we need a comma?
Yes.
Okay, so who was admitted to our hospital? Yeah, and we do need a comma. Where do we need a comma?
After the name.
Okay, so I'm writing regarding Mr. Smith, who was admitted to our hospital. Okay, now is it always a hospital, Dachayani? Or sometimes is it another situation?
Maybe clinical.
Clinical.
Clinic.
So what? So, okay, so is it always a hospital? No. It can also be a clinic. Let's have a sentence regarding clinic. So, Dachayani?
Was visited our clinic.
Okay. We can't say was visited because it's actually, it's something that they did themselves, right? This is the passive voice, so we need to say who visited, right? Our clinic. Now, if it's recent, you can say recently, like this, right? Who visits her. Only if it's recent. What does recent mean, Raji? Recent. Did it happen a long time ago or a short time ago, Raji?
It's short time. Sir.
Short time. Okay, good. Now, there could be other situations here. Okay? But guys, this is where, as I said at the start, you have to adapt what I'm teaching you. So it's very, very possible you will be writing about someone in a hospital or a clinic. But it could be somewhere else. It could be a school. Right? So imagine you're a school nurse, right? And you're writing to the parents of someone. You might say, I'm writing regarding your son, Julian, who I examined this morning, right? That's just an example of something you might say. But I'm just going to give you the most obvious and usual things, clinic or hospital. Okay, now Jancy, after you've given the name and after you've said where, I recommend you give the reason. But Jancy, the reason for what?
For heart surgery.
Okay, so in heart surgery, so this is the reason for the
Admission.
reason for the admission, right? If it's a hospital, or if it's the clinic, it's the reason for the
Tooth extraction or something.
yeah, but it's the reason for the visit, right? Reason for the admission or the reason for the visit.
Okay.
So you might say for a. Did you say for heart surgery?
Yeah, for a heart surgery.
Okay, no
For heart surgery. No
With surgery, it's usually uncountable. Okay, thank you very much. Now, you're saying, I'm writing regarding blah, 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 who was admitted to a hospital for heart surgery. Now, we say for only when it's planned, interestingly, right? So this is for planned reasons. So I could say for heart surgery. I could say for a checkup, right? It's only things that are planned. Raji, what do we do when it's unplanned?
Unplanned, we can say due to a broken leg
For example,
or road traffic accident.
broken
Emergency.
leg. So, or you could say due to a head injury, right? Now, sometimes you know the cause of, for example, the surgery. Sometimes you know the cause of, for example, the broken leg or the head injury, right? So let's start with a broken leg. Jancy, what causes a broken leg?
Following a fall.
Yeah, and you've put in following. Good. So following fall. So the key word here is following. You can say following, Dachayani. What else can I say? I can say following or another word beginning with A.
Sir?
Means following. It's the same thing. After. Right? After, let's say, a heart attack. Right? It's a bit of a simple example. But this gives you the idea now, doesn't it, guys, of how to write a simple sentence. You're looking for the reason. It's very, very important when you're writing a letter. The reason they went into the hospital, the reason they went into the clinic, the reason they are where they are. You need where they are, here, and you need the name. If possible, cause. Do we always know the cause, though, Raji? Do we always know it?
No, sir. Some circumstances we don't know about it.
Good. That's why I've put it in purple. Okay, so that's sentence one. So I'm going to give you all a few minutes, 1 minute to think about this, and then you're going to give me imaginary sentences, okay? So, for example, you could say, I'm writing regarding Mr. TV, whatever, right? Who was admitted to our hospital recently for leg surgery after a lion attack, right? A lion attacked him. Anything you like, okay? It's imaginary. So your 1 minute starts now. Okay, so let's get some imaginary sentences going on just to practice this and show you how quickly you can do this. Raji, can you give me an imaginary intro?
Yes, sir. I'm writing regarding Mr. Green,
Mm-hmm.
who was admitted to our hospital for an endoscopy.
For an endoscopy,
Following recurrent regurgitation.
Following recurrent regurgitation. Fantastic. Okay.
Oh, sir,
Get this.
following a recurrent regurgitation.
Well, actually, regurgitation would be no article there. Okay.
Yes, uncountable. I'm sorry.
So it was easy, it was fast, and this is what you need to do in your exam. So you have more time to write the rest of your letter. Fantastic, Raji. Okay. Let's get an example now
Thank you, sir.
from Jansi. Could you give me an example?
Yes, sir.
Okay, I am writing.
I'm writing regarding Mr. Jones,
Mm-hmm.
who was admitted to our hospital
Yeah.
recently due to a broken leg
Due to a broken leg. Yep.
following a motorbike accident.
Motorbike accident. Excellent. Fantastic. And Dachayani, can I have one from you, please?
I'm writing regarding Mrs. Smith, who
Mhm.
visited our clinic for diabetes checkup.
Mhm.
Following increase in blood sugar level.
Good. You need to say for a diabetes checkup. But that was good. For a diabetes checkup. Brilliant. Okay. Zainab, do you want to try this?
Hello, sir. Yes,
Zainab, do
sir.
you want to try this trick? I know you've seen this before. 5, 4, 3, 2, 1. Have a go.
Okay, I'm writing regarding Mr. Jonas, who was admitted to a hospital recently due to a heart surgery after a heart attack.
Excellent. And we wouldn't say a heart surgery. We would just say we would just say for. You need to change the preposition, not due to. You can just say for heart surgery. Okay. Excellent.
Okay, sir.
So, sentence 1. In sentence 1, the purpose of this sentence. Jancy, what is the purpose of this sentence?
It must be clear for the reader that what we are writing about.
It makes it clear. Good. It makes it clear. Good, because it's an overview, right? It's to make it clear for the reader. Good. Make it clear for the reader. In other words, you're giving them the situation. Very, very simple situation. But in sentence 2, you don't give the situation. Daciani, what do you need to do in sentence 2? Do you know what the purpose is?
What is the result of that?
Okay, you're almost there. It's kind of like a result. But the result is that the person needs to do something next, right? So, for example, she's now being discharged today and requires your care and support. What am I doing? She requires. Let me ask that question. She requires to Jancy. What am I doing there?
What must be done exactly?
What must be done? Good. When?
During and after the discharge.
Yeah, I would say in the future, right? But you could say what must be done. It could even be during and after the discharge. Good. Okay. Now, this sentence is even easier than the next one, right? You're going to start with a pronoun. If it's Mr. Jones, Raji, we'll say
He.
And if it's Mrs. Jones, we'll say
She.
Okay. And then Raji, let's imagine it's not a discharge letter here.
Okay.
What's the phrase that we usually say? We say he or she.
Now requires.
Good.
Or needs.
Okay, or noun or needs. Thank you very much.
Thank you, sir.
Okay. Now, when it comes to requirement phrases, you don't need, I mean, again, just like with this situation here, sometimes you'll get a different situation and you need to respond to that. Okay? OET is a good exam because you have to adapt to what they give you. I think that makes it a good exam. It makes it very hard for me to teach it though, because they can change things sometimes. However, there are usual things that happen. Okay? For example, very often you're going to ask for care and support, right? What does care and support mean, Jancy? If you're a nurse, what are you doing?
Ongoing management.
Well, that's another one. You could say ongoing management here, right? But I'm just saying, what does it mean to say your care and support? What does that mean? What do you do as a nurse? You go to the house? Yeah?
Yes.
And do what?
Home care.
Yeah, it might. Okay, it could be many things. It could be home care. Thank you very much. It might be that it's an old person and that they're already in a home, a care home, right? But it's going to be some kind of home care, maybe wound dressing, right? Maybe all the things that nurses do when they're taking care of people, right?
Okay.
So your care and support, that will apply to a lot of things in case notes. You're just summarizing. Home care, wound dressing, etc. Ongoing management, I guess that might be something like wound dressing, right? That's management. What other things are management, Raji? Can you give me another example of management?
Like monitoring of patient's blood sugar
Yeah.
level or
Okay.
something like that.
Good. So you might say ongoing management and assessment, for example, or ongoing management and support. What other things can we say, Raji? We've got your care and support. We've got ongoing management and support. What else could we say? Imagine we're writing to a doctor. Imagine it's a referral letter, and we don't want care.
Further assessment.
Yeah, good. Further
And
assessment.
management.
It could be further assessment and a management, or it could just be further assessment. Good.
Yeah.
So I'm just going to leave this blank, thing like that. Okay. Excellent. So we're starting to get the idea. I'm just going to give you 3 today, but you could imagine there's probably more phrases. But here, obviously, we're talking about a doctor or a specialist doing something, right? Further assessment and something. I'll just put a blank. But what we mean is a doctor or a specialist, investigating. Investigating. All right. Now I know that's going into another page here, but there we go. Further assessment and let's say management here, just to give you an example. All right. So the idea of this class is to get you writing these fast. The reason is because this is an exam, and exams like IELTS or OET, they require time management. Okay. You can write the best OET letter in the world, but if it takes you an hour, that's a problem. You don't have an hour in the exam. You have 40 minutes only. So if you can write an introduction really, really fast, that gives you more time to focus on the rest of the letter. So I'm going to do some imaginary sentences for sentence 2. Raji, just give me an example of this, please. 1 second. Raji, just give me an example of this, please.
Okay, sir. He or she now requires your further care and support.
It's easy, right? She's just reading this. Good, right?
Yeah.
So let's just get Jancy. Can you read one for me, please? Jancy?
She now requires ongoing management and support.
It's easy, right? Good. Now, obviously, I've left something out, haven't I? I've left out discharge. If you're writing a discharge letter, that means you need to say something about the fact that he or she will be discharged today or tomorrow. So Raji, can you help me out with this? What's a good phrase?
She is now being discharged and needs your further.
You could say that she's now being discharged, or
she is being discharged.
Yep, she is being discharged when?
Today or tomorrow.
Today, right? Or tomorrow. Good. You can also say she's
ready to get this D2B.
Right. Today or tomorrow, etc., etc. I'll just put ... Okay. Yes. So you could put a date in here, couldn't you? But again, it's quite simple. Do we always need to use this phrase, Raji?
No, so it depends upon the scenario.
Exactly. So that's why I've put it into purple. Again, I'm just going to have some people freestyle this, though. Please freestyle me sentence 2 using blah, 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 blah. Okay, it's dead easy. You can see it. I know you're just reading it, but it just gives you a sense of how easy this is once you memorize it. So let's start off with Jancy. Can you give me a sentence that goes dun, dun,
Yes, sir. He's being discharged today and now requires your further care and support.
Fantastic. And Raji, can you do one as well?
Yes, sir. She is ready to get discharged today for your and needs your further care and support.
Good, nice freestyle there. She's ready to get discharged. Okay, not too bad. Zainab?
Thank you, sir.
Yes, sir. She is due to be discharged today, and she needs an ongoing management and now requires an ongoing management and support from your facility.
Ongoing management and support from your facility. Excellent. All right, so I know that's gone to the second page, but that's what you said. That was really, really good. So that's it. So my challenge to you guys now is, can you put it together quickly, right? So I'm going to put this all on the screen. You can see, you can kind of see everything. I know it's a bit smaller. Can you freestyle a full introduction in under a minute? Right, let me give you some examples. Here's me doing it. I'm writing regarding Mr. Black, who visited our clinic recently for a checkup after a bad night's sleep. Okay, he's being discharged. Well, you can't say discharged, can you? Sorry. He now requires further assessment and management. All right, he's being referred to a specialist, let's say. One more. I'm writing regarding Mr. Apple, who was admitted to our hospital recently due to a broken arm following a fight in a bar. He's being discharged today and now requires your care and support. All right, so there's 2 from me. You guys are all going to have 30 seconds just to think about what you want to say. And I'd like you all to say 3 each. No, let's say 2 each, because we don't have that much time. So, 4, 3, 2, 1. Okay, so we are going to get some of our students to write an OET letter in their imagination in less than 1 minute. Okay, now obviously in the exam, you have to find the information in the case notes, but really all you need to know is where. You need to know the reason, right, and cause if necessary. You need to know if it's a discharge, and you need to have a good phrase for summarizing the next thing that needs to be done. Okay, so I'm now gonna ask some of our students to give us 2 introductions from their imagination. They've had 30 seconds to prepare. I'm going to ask Jancy. Jancy, are you ready?
Yes, sir.
Okay, 5, 4, 3, 2, 1, go.
I'm writing regarding Mr. Green, who was admitted to our hospital recently for hip surgery following a fall. He is set to be discharged today and now requires further care and support.
Excellent. I like that. Set to be. That's nice. Instead of due to be, set to be. Really nice. And one more, please, just from your imagination.
I'm writing regarding Mr. Bob, who was admitted to our hospital recently for angiogram following severe chest pain.
Excellent.
He is due to be discharged today and now requires further care and management.
Fantastic. That is excellent. So the final test of this, guys, is I'm going to ask you, I'm going to just choose one of these, all right? So obviously we've been doing them from our imagination. But so I'm going to now ask you to do it with some case notes, all right? And I'm going to choose, what shall I choose? Gerald Baker. All right. Now, Gerald Baker, we know his name. What do we need next, Raji? We need the name. What else?
Where he is now and what is the purpose.
Okay, so where is he? Is he in a hospital, Jancy? I think he is.
Okay, sir.
Yep. So his name's Gerald Baker. He's in a hospital. And why is he in the hospital? Let's ask Dachani. Let's have a look. Why is he in the hospital?
So, for total replacement.
So it's surgery. So is that planned or unplanned?
Planned ones.
So we need to say we can say a hip replacement, right? We don't need to say the full thing. Just summarize and say for a hip replacement. Okay.
Hip replacement.
Do we know why? Do we have the cause of the hip replacement? I don't think we do. What do you think, Raji? Do we know why?
Due to his osteoarthritis since 2008.
So you could say following a history of osteoarthritis.
Yes.
Okay, following a history of osteoarthritis. So let's try and do this. I'm going to ask some of these guys to go through sentence 1. Jancy, can you give me an example?
Yes, sir. I am writing regarding Mr. Baker, who was admitted to our hospital for left total hip replacement surgery following a recurrent history of osteoarthritis.
Okay, and I would just give you the tip of just simplify this. You don't have to say the full thing in your introduction. You can just say for a hip replacement. Yes. And then in your second paragraph, you can give more information. All right, really good. Okay. Now we'll have Raji, please. 5, 4, 3, 2, 1, Raji. Off you go. 1 second. Sorry, 5, 4, 3, 2, 1. Off you go.
I am writing regarding Mr. Baker, who was admitted to our hospital for a hip replacement following a history of osteoarthritis.
Fantastic. Excellent. Sorry, I was mesmerized then by how good that was. That was really, really good. Excellent. Okay. Now, what about putting the two things together? So we've got sentence 1, but we know sentence 2 has to be what needs to be done next. He now requires. Is he due to be discharged soon? Let's have a look. Using the information in the case notes, write a letter. Who will be responsible for Mr. Baker's continued care? Is this a discharge letter, Raji?
Yes, sir, I think so.
Looks like it because there's a discharge plan. So
discharge plan.
So what should we say then? We should say...
She is being discharged today and now requires your further care and support.
Okay. Is it a he or a she?
Mr. So he, sorry.
Okay. And do we know it's today, guys? Look, let's just double check that. It could be today. But we need to be careful with this, don't we? So for the purposes of this video, just don't say today. Here's an interesting little fact for everyone. When you go into the OET exam itself, the date of the letter will always be today, right? So in the exam itself, the date will always be today. All right, so sentence 2. Raji, can you give me an example?
Yes, sir. He is being discharged today and needs your further care and support.
Fantastic. It's easy, isn't it? Let's have one from Jancy, please.
Yes.
He's due to be discharged today and now requires further care and support from your facility.
Okay, fantastic. Dashani?
He is going to be discharged today and now requires further care and support.
Excellent. Right. Now, here's my challenge to you guys. Can you do the whole thing? Right? The whole point of this video is write an introduction in 1 minute. So I'm going to ask Raji to start this. Give me the whole introduction. You have no time to prepare. You've had lots of practice this class. So here we go. 5, 4, 3, 2, 1, go.
I am writing regarding Mr. Baker, who was admitted to our hospital for a total hip replacement following a recurrent history of osteoarthritis. He is being discharged today and now requires your further care and support.
Excellent, 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 excellent. Let's try that with Jancy, please. 5, 4, 3, 2, 1, go.
I'm writing regarding Mr. Baker, who was admitted to our hospital for a hip replacement following a recurrent history of osteoarthritis. He is set to be discharged today and now requires further care and support.
Okay, that's really, really good. Just be careful because with the discharge date, we don't know what date it is because it's an old letter. But that was fantastic.